Well, we can go ahead and get started, and I think others will continue to join. So, Dr. Johnson, like I said before, we are so grateful to have you here. Those of you that have not had the pleasure of meeting Dr. Vita Johnson, I will let her introduce herself and share a little bit more about her background. But
Mhm.
um, she has been in the space of school. She's been, I don't know, you invented the work in Georgia of getting school-based health
Mm,
centers created. And she's just one of our extreme phone of friends for all things pediatrics and trauma-informed care and school-based mental health and behavioral health. So Dr. Johnson, thank you for being here with us. And if anybody has questions, hopefully we'll have some time at the end. If we run out, though, be sure to put those in the chat and we can follow up as we go through Dr. Johnson's presentation. But thank you so much for being here and sharing the opportunity that all of us currently have.
Well, as always, uh, it's my pleasure to be in your presence and all the great work that you guys are doing. And I don't know if I need to go into any really extensive backdrop of what I've been doing, just to say in summary that I'm a general pediatrician, but I think I was a social worker in another life.
Mhm.
And my work, I don't know, for the past 35, I don't want to age myself, 40 years has been creating systems of care for children living in under-resourced communities. That's my heart, and that's my passion. Started the first School-Based Health Center about 30 years ago. I can't believe it's been 30 years. With the intent of just improving the health of children in a school setting. Didn't quite understand what I was getting myself into, but I thought it was interesting. Um, and uh, and for the first, I don't know, 6 or 7 months, I was really busy taking care of a lot of chronic health problems and creating referral sources for our children and understanding the needs in terms of the lack of access and all of that. But it dawned on me after about 6 months or so that the physical health for these children really weren't the main issues that were impacting their ability to do well. It was all of these psychosocial issues that I could see up close and personal. I always say, later on, I would say, I, I can actually see these children three-dimensionally, right? Prior to that, it was like one dimension when parents bring their children to your office and they share what they're going to share in that limited time and put a face on their children and their family circumstances, and it's usually just one dimensional. But I learned very quickly with school-based health, I get to see everything in the context of all those factors that impact the lives of children. So it's been my passion, among many other things that I do. School-based health centers, is sort of the expansion of school-based health centers is my primary focus. And so that's kind of basically what I do. I am a professor of pediatrics at Emory. I've been with Emory, it seems like all my life. I trained there and did my residency, went to medical school, did my residency. I had a short hiatus in Mississippi for 4 years, came back to Atlanta and was recruited within 6 months to come back to the university and start these community-based programs, which I won't go into, but school-based health centers was one of them. So I'm going to talk to you today about school-based health centers in general and the value of them, but also what's happening in our state, which is real exciting and frightening at the same time. But I'll try to go through this. Now I'm going to see if I can remember this. All right, so I have a guiding principle. I came across this quote, I don't know, probably about 15 years ago from Frederick Douglass that says it's easier to build strong children than to repair broken men. And I said, okay, that's it. That's exactly what I'm about. I wish I had actually come up with that quote, but of course, Frederick Douglass lived a little, was around a lot longer than I have been. But I love this quote, and it really does sort of guide the work that we do, not only with school-based health centers, but all the work that we do at Partners for Equity in Child and Adolescent Health, which I actually direct. And so this is really what sort of leads us and guides us as we attempt to address the needs of children and their families throughout the state and really throughout the country. And now I can't move this forward. Oh, there we go. I just want to hit upon, and I have to apologize, I usually, this is a 2-hour lecture for me, so I'm just going to hit on some of the important points and try to tie them together. But I think in order to build strong children, you have to address poverty. And, poverty is the single greatest threat to a child's well-being. And any adverse event or deficit in the child's life can almost always be attributed to them living in poverty. So that is another goal of ours, is how do we break the cycle of poverty and build strong children? What does that take, right? So just a little bit about the magnitude of the problem in our country. We know that those children that actually live in poverty have increased rates of health problems and mortality, increased risk of academic underachievement, school dropout, incarceration, and unemployment. And of course, they have a slew of emotional and behavioral problems. Our nation, we basically should be ashamed of our position in the world when it comes to the number of our children living in poverty. About 16% of our children do in this country, and about 41% live in low-income households. And this is one of the highest percentages of children living in poverty worldwide. If you look at the top 40 countries in their rating in terms of the percentage of children living in poverty, we rank 38th out of 41. And if you consider that we're probably the richest country on the planet, this is truly an indictment against us. What you don't realize is that we actually rank below Mexico in percentage of children living in poverty. And of course, it's how you define poverty, country to country, but the fact that we rank so low is really an indictment against us as a nation. In Georgia, we all know these stats. I'm sure you've seen them over and over again. From the latest Kids Count report in 2022, we ranked 38th. I've been doing a similar talk for probably the past 10 years, and I think the lowest we were ranking was like 44th when I first started, and then we sort of gradually increased, which was great. But we can't get beyond, the lower 10% or so of the country in our children's overall well-being. We ranked 35th in the child economic well-being, 45th. That has dropped dramatically since 2021. And overall child health, 38th in education, and 40th in family and community support. And all of these numbers have basically decreased, with the exception of percentage of children living in poverty, because I think the entire country has been affected by it. And so we sort of remain stagnant because of that, not because we're actually showing improvement. It's just like everybody else is getting worse. So how do we build strong children? Well, first, like I said, it has to start with addressing childhood poverty. And I think what that requires is to start early with high quality early childhood education. We have to really focus on quality primary and secondary education, make sure that children have continuous and quality access to healthcare. We need to improve the support for our families because, our children live in the context of their families, and you can't care for children in a vacuum. So you really have to address the needs and the challenges of families in order to improve the outcomes for children. And we need to increase parenting support to facilitate work and family life. So I think those are the basic elements in addressing childhood poverty. I think very highly of the need to maximize academic achievement for children, because education is a pathway out of poverty. And also education is a direct predictor of health. So as a physician, my ultimate goal is to maximize the health and well-being of children. And so all of us, and especially pediatricians, need to focus on education and how do we maximize the academic achievement for children. So where do we sit with education? It's about as dire as percentage of children living in poverty. Approximately a third of our children can't read proficiently on 4th grade or 8th grade. This has not changed. I don't know how, as far back as I can remember, at least 15 years. And only about 40% of our 4th graders and even a fewer number of our 8th graders are proficient in math. In Georgia, we sort of are consistent with the national percentages. About only a third of our children can actually read proficiently, and only about a third can perform proficiently in math. We rank in the lower 20% of the high school graduation rates, and we've actually improved significantly since over the past 10 years. I think when I started, our graduation rate was around 70, and now it's increased to about 81%. That data has some caveats, and and it's sort of nuanced because it depends on how you actually count children who graduate. And I won't go into some of the factors, but I don't think it is as good as this, because I think the 81% who actually graduate from high school are not eligible to enter the workforce because of their educational achievements. I think we just fudge the numbers a little bit in some ways. And we know that one of the reasons that our children do poorly in school is because they're absent so often. And about 11% of our children have chronic absenteeism. And a lot of that is due to health. So let's talk about education. We have to start, like I said, early, and we have to look at school readiness. Only about 60% of our children in the country attend.
Is this not a, it's an Outlook.
I'm sorry. Okay, I know somebody was talking to someone else. But about 60% of our children don't have the opportunity to attend preschool. And if you look at minority children, they have a tendency to attend a low quality pre-K and are less likely to attend high quality pre-K programs overall. This is really interesting to me, that center-based infant care, infant child care costs more than public college tuition in 30 states and DC. It costs more for children to go to childcare than it is for them to attend college. And since 2006, the number of children receiving subsidized childcare has decreased by 430,000. So we have a long way to go in order to improve the opportunity for children to have that preschool experience. So how do we raise strong children through health and academic success? So this is a picture of me not too long ago, actually quite long ago, at my first school-based health center. And the child next to me, this wonderful child next to me, is the grandson of the principal. And he was so apprehensive of me every time I came around. I was supposed to be embracing him, but he only came as far as that. But anyway, this is the first school, and this is where my passions were lighted in terms of school-based health and working with schools to improve the health and well-being of children. So why is health and education important? Well, there are things that we know based on some of the coordinated school health programs that have been around since the 90s. We know that school health programs and policies can be a very efficient way to prevent or reduce risky health behaviors and avoid serious health problems. But we also know that they can help close this educational achievement gap that we see between disparate socioeconomic groups of students and children of color versus white children and the whole gambit. School health and providing wraparound services for children really does address their needs so that they can be in school and receive instruction. Talk a little bit about coordinated school health programs. I don't have time to go into in detail. The CDC came up with the first coordinated school health programs, and it involves having a series of supports for children that range from health services to nutritional services to counseling to community involvement to parent involvement. And it's been proven to be successful in improving the academic achievement for children. So school-based health centers, as I'm going to describe in a minute, they really exemplify the basic tenets of a coordinated school health program. So keep that in mind. It's important to know, and it's sort of common sense, that school-based health centers, they actually lie at the nexus of health and education, and because of some no-brainers, right? We know that good health and good education are mutually reinforcing. Students learn best when they're healthy, when they're present, when they're connected to the school emotionally and socially, and that means that they're actually being validated by those that teach them. And students learn best when there's hope, when they have a will to learn, they learn best. So those are the things that really, it's association between health and education. I also want to just comment a little bit on the benefit of school-based health centers or school health in advancing health equity. And again, like I said, education is a pathway out of poverty, so that contributes to health equity as well as being a direct predictor of health. So what is a school-based health center? Well, quite simply, it's a doctor's office in the school. So all of the services that you normally would receive when you go to your doctor, you would receive in a school-based health center, plus. So most doctors' offices are not able to provide, dental care or integrated behavioral health services or vision care. But the model of school-based health centers, the ultimate model, supports all of those things. But more importantly, is a multidisciplinary health center that addresses, like I said, not only the physical health of children, but all their oral health, mental health needs. And it serves as a collaborative partner with the school system that provides wraparound services for the students as well as the staff. And again, it's a center that promotes wellness for students and staff. And one thing that I found that I didn't understand until about 3 or 4 years into this work, that it serves as an important mediator between family and school. School-based health centers are a neutral entity within the school. Parents are not threatened by the work that we do. Sometimes they're threatened by teachers and school as a whole because they've had bad experiences, or they only call to the school when their children are not doing well. But when they come into the school-based health center, it's sort of like a sanctuary of sorts for our families. And so as such, we can actually mediate some of the challenges between the teachers and the parents in a meaningful way. And I did a lot of work in that space, and I can go on about that, but I think that's probably one of the most important roles of school-based health centers. Again, school-based health centers represent the most effective system of care for children and adolescents living in under-resourced communities, mainly because it essentially reduces every barrier to healthcare that you can think of. The barriers of access, cost, transportation, especially a parent's inability to take leave from work, and I think even more importantly, a caretaker's inability to prioritize the healthcare needs of their children. There are no real bad parents. They're just parents that are basically challenged by all of the cares of this world. They're challenged by, making sure that their children have a roof over their head and food on the table. And they're also challenged by their own personal trauma and the issues that they have to deal with, especially if it's a mental health disorder or if it's a substance abuse disorder. Our parents really sometimes just can't prioritize the healthcare needs of their children. In addition to that, a large number of these children are being cared for by grandparents and great-grandparents who don't have the mobility or the resources to make sure their children make it in to see a doctor. And so we essentially eliminate all those barriers because we go to where the families are, as opposed to asking them to come to us. And again, like I say, it's a multidisciplinary approach to providing healthcare, and very effective in addressing health disparities in the context of the social determinants of health. A lot of research has gone on. School-based health centers have been around since the 60s. Most people don't realize this really came to light in the 80s. It started in high schools with the attempt to reduce teen pregnancy, and then it sort of evolved to provide, just comprehensive healthcare for adolescents. When we came on the scene in 1994, there were essentially no elementary school-based health centers, and so we actually introduced that model into the mix. But there's been a lot of research conducted over the years, and we've participated in a lot of it, and we've written a lot of papers around the benefits of school-based health centers. One thing that we know, common theme, is that it definitely increases access to quality health care. It improves health outcomes, especially with children with chronic health problems. It improves school attendance and academic performance, especially for those children who have social and emotional challenges. It improves school connectedness, and it decreases the healthcare costs to the state. And we've written several papers along with the rest of the field in demonstrating this. So this is our first school-based health center at Whiteford Elementary. So I'm sort of in the middle, looking fairly youthful. For those of you who know, have heard of and know Dr. George Brumley, who was my partner in crime with creating this school-based health center. He's the third from the right, and the wonderful woman in the white suit was the principal of the school, and I can go on and on about her and her passion and love for these children. And she was a true maverick because she would always do things that she wasn't supposed to do and violate policies so that we could do the work that we were doing. But this was our ribbon cutting ceremony. I have to tell you, I just had my last child at that time, and I got out of my bed.
They were very sweet at Sonnet. I just called and talked to them.
Uh-oh, somebody's talking. I had got out of my bed so I can come for this ribbon cutting ceremony. So I'm looking a little drained and tired on this picture. Just talk a little bit about this center. It was full service. We called it sort of like the Cadillac version at the time, or I guess the Maserati version, current day vernacular, of school-based health centers nationwide. We had a very comprehensive primary care. We had a dental operatory. We had extensive behavioral health services, and I can go on and on about all the things that we did that we had no idea what we were doing. So like trailblazing, but we had no idea. We had extensive community outreach, and we developed a whole community program around the school-based health center. So as a result, we had a lot of accomplishments. Clearly, we were able to increase access to healthcare for these children. We demonstrated that we improved school attendance, which we didn't necessarily attribute to the overall performance, but we know they had an impact on performance. We improved the health outcomes for children with chronic illness, and I wrote a paper on it, especially in terms of the children with asthma. We improved risk factors for children who were overweight and obese, and again, reduced the cost to the state's Medicaid system, mainly by reducing ER utilization and hospitalizations of children with chronic illness. These are the three accomplishments that I think I'm most proud of. We were able to facilitate the recovery of many emotionally troubled children, starting in our pre-K program, going all throughout our school-age children and adolescents. We were able to improve the academic achievements for children with learning disabilities, because I really targeted those children and those with ADHD. And like I said, probably the most impactful aspect of our work was to increase parental involvement in the lives of their children in the context of their schools. So for 15 years, I actually ran the only 2 school-based health centers in the state of Georgia. After Whiteford, about 4 years later, we opened a second school-based health center at Cohen Middle School, which was the middle school in the community, which a couple of blocks away from Whiteford, mainly because the parents insisted that I do so, and also the principal of that school. And so for about 15 years, actually longer than that, about, 18 years, we only had 2 school-based health centers in the state of Georgia. And this model, and it was our intent, even, much earlier on, that we needed to take school-based health centers to scale throughout the state. And we actually worked with several communities over those years, provided guidance and technical assistance to see if they could develop these centers. Some of them started and weren't able to continue their effort. But for the most part, we were the only operational school-based health centers in the state. And so I left Whiteford in 2009 to create Partners for Equity in Child and Adolescent Health so that I could actually take these centers to scale. And as I thought about the process, we did a lot of research and looked at some of the challenges for other states and other communities and why they couldn't take school-based health centers to scale and sustain them. And so we came up with the notion or the concept that there are 4 basic elements that are required in order to do this work. The first is, first and foremost, which is really where most of these centers failed, is that you have to recognize community need and support. You have to have community buy-in in order to actually create an effective school-based health centers and also to sustain it. Especially, I've learned that in spades as I've worked throughout the state, especially in some of these small communities, northern part of the state, as well as, throughout the state, that the community has to take ownership of this in order for it to be effective. You have to come up with a sustainable model, because the vast majority of school-based health centers were funded with startup funds. And then after 3 years, when those funds would go away, a lot of these centers were not able to sustain themselves. So you have to come up with a sustainable model. And you have to prove that what you're doing is of value, right? You have evidence of health improvement and cost impact. And fourth, you have to apply implementation fidelity to this whole model, that you choose a model that works and you implement it as closely as you can, and so that you can create a viable model throughout the state. So those 4 basic elements are required. And as we attempted to expand these centers, we were able to capture all of this in 3 phases. The first was planning, the second implementation, and the third in sustainability. And I'll go through that. So this is where we do the bulk of our work, in the expansion in the planning phase of school-based health centers. So in 2010, we issued our first RFP for a planning grant for counties to apply for. I was really sort of embarrassed when I came up with the amount, $10,000, and I had no basis of why I chose $10,000. I just thought they would be enough to sort of galvanize people around the whole concept, and actually it's worked brilliantly over the past 10, 11 years. So we issued the RFP, and the counties were to apply for this $10,000 planning grant, where they were to basically galvanize the community around the needs of their children. They were to bring together all stakeholders in child well-being to form an advisory group. And then they were to conduct a formal needs assessment using primary and secondary data. And from that data to define strategies to address the needs as they were demonstrated. And then they were to look to see which school would be best suited to actually start a school-based health centers. School-based health centers, they were to choose a medical sponsor, and then we helped them to develop a business plan for establishing the center. The grantees were required to, and are still required to, come out to Emory 3 times throughout the year for 2 workshops, one for just basic school-based health centers 101, marketing, outreach, and all of that. The second one deals with creating a business plan, and the third is sort of a wrap-up where they, do presentations on their process, their challenges, their successes, and it serves as a networking opportunity for all of the grantees. To date, we've funded 54 planning grants that represent about 58 counties, and the majority of them were in rural Georgia. We did not set out to actually target rural Georgia. It's just that when we issued the RFP, we actually issued it initially through Families Connections. All of the rural communities rose to the top. And as we reviewed the applications and saw the need, we decided that our best effort would be placed in the rural parts of the state. So here's a map of our planning grants, and as you can see, is throughout the state. And I have to tell you, I probably have visited every single one of these counties. Now, I'm a Georgia girl, right? And I grew up in Atlanta all of my life. Went to college in Michigan, came back home and did all of my medical training, but I had no idea that we had 159 counties in this state. And when I found out that we had 159 counties, it was like, why is that? Of course, there's a reason behind that. And then I looked to see what other states had. And as it turns out, we're only second to Texas, which has 166 counties, right? So anyway, I visited the vast majority of these counties and many more. There are some on here that we didn't give planning grants to, but I visited them anyway because they've called me up to say, can you come and talk to us? I remember Elbert County is one of them, Wayne County, Liberty. So there are a lot more counties that we've been involved with, but these are the ones that have actually received our planning grants. And they're color-coded by the year that we actually issued the grants. So we've, since that time, since our first RFP, we've actually increased the number of school-based health centers from 2 to over 105. And that's not what I had intended to do when I set out to do this. Our goal was to increase the numbers by 2 to 3 every year. I thought that would have been, a measure, a marker for success if we could actually, create 2 new school-based health centers. But as you can see, that number increased significantly. And I think it's because, once the state understood the value of this work, and for those who were actually doing the work, they, independently of our efforts, chose to expand. And it's sort of really like, a momentum that has taken hold in this state that has really led to this massive expansion over 9 years. We lead the country in the number of school-based health centers that have been created over the past 9 years. And with the governor's initiative, we're going to exceed, essentially, I don't think anybody's ever going to catch up with us in terms of expanding school-based health centers throughout the state. About 60% of these centers are located in rural communities. We have quite a few of these schools that actually serviced by mobile health centers. They don't have on-site, but they provide comprehensive services to children that they service. Over 80% or more have on-site behavioral health services, but all of these centers screen for behavioral health risk factors. Right now, only about 10% provide on-site dental services. And we have 2 comprehensive vision centers associated with Albany Area Primary Care that serves the entire school districts in those counties. And so here is a map of where all of the functioning operational school-based health centers are. On the right are some of the names. It's not a total a depiction of all of the individual schools that have school-based health centers, but like I said, it's over 105. I was told the other day it's probably 107. I can't keep up with them, tell you the truth. Every time I turn around, somebody calls me up and says, okay, we're opening another one now. And what's interesting is that even though our planning is for a year, sometimes it takes a community 2 to 3 years to actually, get to a point where they can be operational. So I could have had a planning grant with someone, 3 years ago, and then they call me up and say, okay, now we're ready, come back, we want you to talk to us again. And that's usually the pattern that happens. So I want to end by just talking about the governor's initiative, which was very surprising. It was totally unexpected. I was called to a school, but prior to that, I was contacted by a colleague of mine in the Department of Education who said, I think the governor wants to support school-based health centers in a meaningful way. And I said, okay, what does that mean? She goes, I don't know. She said, but you need to come and talk to his chief of staff, or the person who was head of the budget. I can't remember exactly who the gentleman was, but he said, you need to come talk to him, and they want to see a school-based health center. I said, well, okay, well, I know the one that I want them to see, but as it turns out, they ended up going to another school-based health center, which happens to be the smallest school-based health center in the state. And I said, okay, well, that's not going to give them a good, that's not a good representation of the model that we have throughout the state, but it's a very effective model. So if they want to go there. So I met them at the school, and we did put on a dog and pony show for the governor's staff. And then the person who was over the budget took me aside, and he says, but Dr. Johnson, this is quite a bit of money that we want to invest in school-based health centers. And I said, okay. And I'm thinking, I don't know, $1 million, that's a large amount of money, given the fact that I've been petitioning the state legislature to create a line item for school-based health centers. They eventually allocated $250,000 pre-COVID to one county. So I'm thinking maybe it's $1 million, and he says, no, it's a lot of money. And so I said, well, what could it be? 5 million. And then he tells me it's 125 million that you're going to have to spend over 3 to 4 years. And I said, did you say 125 million? And he says, yeah. Now, to put that in context, there's in the national budget, in the federal budget, there is $50 million nationwide for school-based health centers. And I was listening to a guy who was telling me that the governor wanted to allocate 125 million just to our state alone. And I tell you, I was really excited initially, and then I became a bit panicked, and I said, well, first of all, I think I can't begin to thank you guys for considering this type of contribution. I don't think you can do it though, because you have this sort of tight time frame where you have to spend the money in about 3 years. And it's taken me 10 years to increase the numbers from 2 to 100. And so you want to add an additional 100 plus school-based health centers in about 3 years. And we can have a conversation later on about how I think that's a somewhat impossible feat. But nevertheless, I said, and I actually counseled them to maybe put half of that in school-based health center and the other half maybe in some wraparound services for schools throughout the state, which I think are equally as important. But at the end of the day, they came back and said, no, we want the entire 125 million to go toward developing new school-based health centers. So that's where we are right now. And they wanted to focus primarily, initially, only on rural schools. And I said, you're never going to spend it if you do that. So they changed midstream and said they added urban school districts as well as rural. The initial schools that are going to be targeted clearly are going to be Title I schools, because school-based health centers, is an ideal model for children living in under-resourced communities. They're going to put priorities on CSI schools, or comprehensive support and improvement schools, which are schools that are in the lower 5% of the state. They perform at the lower 5% of the state by a variety of measures. And also the TSI schools, which are targeted support and improvement, which are schools that perform in any one of these factors below the state average. And then promise schools, which are schools that perform are in the lower 5 to 10% of the state in performance. So that's who they're going to target, both in the rural and the urban areas. The project is going to be administered through the Department of Education, and funding for planning and implementation, it's going to be provided directly to the LEAs or the school districts. Now I have some concerns about that, and we can talk about it a little bit. But you know, I tried to emphasize that you can't put this burden entirely on the school districts. They have too much to deal with. So it is advocated that they have a joint collaboration, that the school districts have a joint collaboration with the medical providers, community organizations, and other community stakeholders, so that they won't have to do this work on their own. So that's the governor's initiative. So I want to end by just mentioning why I think school-based health centers are so important. To me, it is about increasing access to healthcare. It really is about making sure that children, who live in these under-resourced areas, that their healthcare needs can be met, both their physical needs as well as their mental health needs. But I do think it's a means to an end. It really is about how do you maximize the academic achievement for children? How do you make sure how do we raise the needle on those children who are performing on grade level by the 4th grade and then graduate on time? How do we create a culture of wellness for students and the staff? How do we increase parental involvement? Because we know that's central to a child's ability to do well. But more importantly, I think it is a matter of how do we move children out of poverty? Remember I said poverty is the single greatest threat to a child's well-being. And we can only do that by making sure that they have an effective and meaningful education so that they can move themselves out of poverty into a happy and healthy and productive adulthood. So with that, I will stop and answer any questions that you may have.
I have a question. I'm curious how you've kind of intersected with the charter school community. Statewide charter schools are their own kind of LEA, right? And tend to several focus on the Title I community and go into high need areas.
So, we're not going to discriminate between whether it's a charter school or public school, because they're kind of like intertwined anyway. And so we're going to leave it up. So the Department of Education is going to decide which schools would be best. But I think all Title I schools, whether they're charter or public, will qualify for this. My first foray into the charter schools began about 3 years ago. Actually, we have two school-based health centers in the KIPP community, right? So KIPP Vision, which is sort of the traditional KIPP school, KIPP charter school, and KIPP Woodson Park, which is sort of non-traditional because it's actually still owned by APS, even though it's administered by KIPP. So the difference is that it's not a lottery, right? So the KIPP Vision, Woodson Park, children who normally would have gone to those schools qualify to go back to those schools. KIPP Vision and the other KIPP schools, there's a lottery for those. But I think they're equally as important, like you said, because it's same population of children, same needs, same challenges. And so I don't differentiate between the two.
I see that Alex dropped a question in the chat that I can read. So if Thomas County was already granted funds to launch an SVHC in our county schools, could their city school system apply for funding if they have two separate? Okay, go ahead.
Yeah, they have. And they have, right? And so we're actually working with Thomas City Schools this year.
So Dr. Johnson, thank you. That was amazing. Our coalition is in Gwinnett County, which is the largest school district, of course, in the state, the most diverse, et cetera. And to your point of the school system has a lot to do. I can totally agree and support that.
Mhm.
What is the level of awareness? How far are we on a timeline of rolling out this information and for school systems to be aware and to begin any sort of process of consideration for taking advantage of this opportunity?
Okay. What is your role in Gwinnett County?
So I lead the Gwinnett Coalition, and we are a one of cohort 3 with Resilient Georgia.
Oh, okay.
We're coming through this through the lens of Resilient Gwinnett
Oh,
as
absolutely.
one of our focus areas. Yeah.
Yeah. So I have a long history with Gwinnett County. It's a bit, well, I'm trying not to categorize it in a negative way, but I've had some challenges with Gwinnett County. Matter of fact, Gwinnett County was one of our very first grantees for the planning grant. And the partners weren't there. I mean, they didn't have the ability to galvanize the community around the need. That was really the main issue. And the school system wasn't ready either back in those days. And so I currently have been having conversation with CPACs, who's been trying to work with the school district, the superintendent, to develop a school-based health center. Actually, they've been working toward that end probably for 5 years or more. But to answer your question, all school districts have been made aware of this opportunity. The superintendent knows, and I'm pretty sure that they've notified the correct personnel to prepare themselves to apply for this funding. Again, like I said, I think it's critically important that the community as a whole works together to support the school as they attempt to do this, right? I think the challenge is when the governor or the powers to be decided that these dollars would go directly to the LEAs, to the school districts, for them to manage, it's going to be really problematic. Because, with a large, school district like Gwinnett, you have resources. You have more resources than, say, a small county like in Thomas County or in Irwin County or, some of those really small counties. And they're going to be challenged to manage this money. I mean, they're going to have to distribute it to the medical sponsors. They're going to have to be responsible for they're going to be accountable to what they do with the money, the reporting, all of that. Just the financial accounting is going to be a strain on any small school district, and it's going to be really difficult for them. So I'm hoping that they're going to rethink that aspect of it and let the Department of Education really assume that responsibility and not place that huge burden on the school district. But even so, there may be some resources that the school district can tap into in order to do some of this work for them. But it's going to be a real challenge as we go forward.
So thank you for that. I was aware, Ellen Gerstein was the founding director of the Gwinnett Coalition, and I arrived 2 years ago when she retired. But I did ask her about school-based health clinics, as I knew very little, but thought this could be a great opportunity for our community.
Yeah.
So yeah, we've been there, done that, got a whole big file over here. And then I saw, but to your point, the school system was not ready then, but we have, as you know, a new superintendent, a new board of education. And we have, I would say, a level of readiness that probably was not in place before. And in fact, our Andre Castro is a representative from our public health department is on the call today, listening and learning. And then, the United Way is right in there with us. And so anyway, and importantly, Gwinnett County is re-envisioning their community schools program, right? So this brings a whole new level of thinking around not just academic press, which has been our focus for the prior 27 years, to academic press and communities of support. And this is, I think I'm hopeful, but anyway, I appreciate the call today and this additional information.
Yeah.
And I may reach out to you separately on just some lessons learned.
Okay.
Gwinnett.
Okay, please do. And really, I don't know how I can bring, I don't know what the rift is or has been between CPACs and Gwinnett County, but I know they were working really closely at one point, and then everything just sort of fell apart. And they had money, they still have money even prior to this announcement to start a school-based health center.
And CPACs is going through its own set of issues today, right? Which is, but Victoria Wynn, who was a senior VP previously with CPACs, she's on my board.
Okay.
So I'm reaching out, I'm connecting the dots. And so anyway, thank you again.
You're welcome.
So I do want to uplift one more question from the chat. Sandra asked, can a LEE apply for funds to support a mobile school-based center at a community school?
No. They're not going to support mobile units. They will support only, they will support like a modular unit that's on the property. And of course, it's best if the school-based health center is inside the school, right? Because of many reasons, children have to exit the school and you have, and you can be more integrated into the fabric of the school when you're inside, but they will not support mobile units. This funding won't.
So we are at 12:47. So we are at time, and I just want to say, on behalf of myself and Emily and Dr. Johnson, we're so grateful for your time today, sharing all this amazing information with us. And I'm also grateful for everyone on the call today. Thank you.
It's been my pleasure. And if you guys need to reach out, don't hesitate to do so. Okay.
Thank you so much, everyone.
Okay. All
Have a
right.
good
Bye-bye.
Thank
afternoon.
you.